this end, his clients can expect to receive professional, individualized attention as he works tirelessly to provide them with a positive outcome on their claim. Insurance company's number one priority is to pay you the least amount possible. At the Whistler Law Firm, their main goal is to get you the most money for your claim. Contact the Whistler Law Firm today at 561-299-4523 and let them get you the most for your claim. That's 561-299-4523. Dr. David Levin, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levins can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levins has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levin's office today for a free consultation at 954-752-1020. That's 954-752-1020.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And we are back. Happy Monday to you. I'm Rhonda Hines. And I'm joined today by one of the best plastic surgeons in the business, particularly in Southern California. Dr. Levins, how are you?
Southern Florida, whatever, somewhere.
Southern Florida. How are you doing tonight?
South California. I'm good. I'm good. How are you doing, Rhonda?
Relaxed I've seen you, actually. The most relaxed dress.
Because I don't have I'm trying to get into the screen here. Okay, good. Because I don't have a suit on. It's like COVID style.
Yeah, I like it. So has your office opened back up this week?
Yeah, we opened last Monday. So today's Monday. It was a week ago. And I did my first surgery last Friday. And then I did two surgeries today. So we're back in business.
What type of surgeries are you doing?
Well, the first one I did was a massive weight loss patient. I did it at the hospital. She was very eager for her surgery. And she had very large hanging so-called bat wings. And then her breasts had sagged quite a bit. And so we did a procedure to take care of the arm and arm lift and a procedure to make her breasts perkier and tighter and nicer. And that was at the hospital. And then today I did an eyelid surgery and a breast augmentation. So it was a good day.
So, yeah, it's your business as usual, it sounds like. For you?
Yes, almost.
How long did that take you to do the massive weight loss patient, the patient who had to have a lot of body lifting and
that procedure at the hospital took about 5 hours, and we did it at the hospital because it was the type of procedure I wouldn't really want to do as an outpatient. So I preferred to do it in the hospital. Not that she had to stay overnight, but it's a larger procedure that I don't like to do necessarily outpatient. She was healthy, very comfortable. She did go home, but I just felt more comfortable doing it in the hospital to have more resources, more help, more hands. And actually at the hospital, so speaking of coming out of COVID-19, Broward Health, which is the large hospital district in Broward here, is requiring a COVID test. So she had the test the day before, came back negative. So we felt confident that we weren't jeopardizing her health or our health by doing the procedure. But of course, as you know, I don't really want to keep talking about this, but we can talk about it a little bit, that the testing is not perfect. Yeah. There are false negatives, false positives. You can be totally asymptomatic. So when patients come to the office now, we are doing all of the screening, checking temperatures, asking a history, and then using precautions, using masks, gloves, trying to distance ourselves as much as you can distance yourself when you're injecting someone. But you have a
Right.
mask on, and you try to take all the precautions, wipe everything down with a greater than 70% alcohol mixture, something to kill the virus and all that stuff. So far so good.
And spacing the patients out,
Let me
as you
look over
mentioned
here.
earlier. What did you say?
I'm not sure. I'm going to look over here. I think I'm looking over. I'm not looking. I'm looking at you. I'll look
Oh,
over
yeah,
there.
yeah, yeah. Whatever's
camera.
comfortable for you.
Okay. Okay.
So I was saying you're also spacing out the patient, so that also reduces risk. And then you're doing the procedures where you
Absolutely.
wipe it down. So how
Wipe
many
everything
patients are
down.
you?
Well,
Go
so in
ahead.
other words, say we saw like 8 or 10 patients. Say we saw 8 or 10 patients a day, or 12 patients before COVID. It's not a high volume practice, but now we're seeing 4 to 6. So we're giving a good hour or so for every patient. We're asking family members to either stay in the car or wait in the waiting room, or not even come in at all. And if a family member wants to come into the exam room, then they have to wear a mask, and we're definitely taking a temperature. We have an infrared thermometer, and we're taking all the precautions. Everything's good. How have you been doing?
I've been doing great. Everybody's healthy. I'm enjoying more time with my
Good.
son. I feel
Good.
like it's been kind of a nice breather in a way, a moment to kind of catch your breath.
You have to turn it into a positive. You have to turn it into a positive, because it's been terrible on the economy, terrible on the poor people that passed, terrible on everything. But now thank God we're opening up a little bit, and you have to turn it into a positive. A lot of cleaning of closets went on, and during the during the shutdown. So it's been good. It's been good.
A lot of people said they got a lot of cleaning done. I think I opted to read and work out instead because the
You
house is
didn't
still
do
just
any
as
cleaning at all. Maybe you're clean enough. You didn't have to clean anything. Actually, my wife,
that's
it's the funniest thing, because she's been saying for years that she has to clean her closet, and so she did clean her closet. Well, you're saying, wouldn't it be ironic if the worst pandemic in 100 years, and she still didn't clean her closet, but she cleaned her closet out. So we're in good shape.
That's good. But
Yeah.
another thing that's kind of people have been highlighting is, hey, I see more people exercising probably that normally don't. The bikes, trying to find a new bike or a used bike, bikes were flying off offer up before I could even get one, because people are
Really?
like, okay, I can't go to the gym, and but I can go bike. So bikes literally must have hit a high.
Yes, I would say liquor stores and bicycle shops did well. I think we got cut off here. I lost your audio.
Oops, sorry. I think I
That's okay.
accidentally clicked my keyboard and turned off the audio.
That's okay.
But I'm saying at least the drinking and the exercising went hand in hand.
Yes,
So
yes. Well, you have to balance it. You have to balance it. Yeah.
has anything else changed with your practice, since the virus that patients need to be aware of?
No, we're like I said, back up and running, just trying to be cautious. And we had, I think we talked about this a few weeks ago, the last time we spoke, that there were a handful of patients that were ready to have their procedure, and of that handful of patients that were on the books, are now on the books. Like 1 out of 12 decided financially that it's not the right time, and you can imagine some people out of work. And then one person was a little bit anxious because they said, you know what, I'm a little apprehensive about having a surgery in case I have it or whatever. So, but the vast majority are proceeding, which is great. Very pleased for that. Very happy.
Yeah, I think great. I think those are the people who just, they wanted it done and nothing was going to stop them, right? That's what it
There were
sounds
some of
like.
those. Yes, there are a lot of those. Well, besides, I think we talked about this too. There were people that wanted to get it done during the closure. So they, literally, look, I'm off for a week for work. Let's
Yeah.
get it done. The problem was getting a facility that would be willing to take people, because the responsible public health thing was to say, let's see what happens here. And now that we're open, Palm Beach opened, well, Northern Florida opened, then Palm Beach opened. Now Broward's opening. I think Miami-Dade is going to open real soon. So it's all
Yeah.
good. And
Yeah,
we'll
we're
be back
slowly
in the
going.
studio. We'll be back in the studio before long.
Yeah, at least I get to see you this time, which is nice. Last time we did it,
There
it
you
was
go.
audio only. This is kind of
Exactly.
neat that we can do it this way.
Exactly.
Now,
Yeah.
we've never really talked a lot about procedures for body sagging, sagging skin. We've talked some in our past, particularly, I think, men. I'm sure they also like to get procedures for body sagging. What percentage would you say of your male clientele actually come in for that procedure?
Absolutely. I definitely have men that have surgical procedures and injections, but they are the minority of my practice. I'd say maybe 10 to 15%. Of course, men, the main thing that I do surgically for men is the gynecomastia, or man
Hmm.
boobs. But when men have lost a lot of weight, just like women, they have 5 areas generally that bother them, starting from the neck to the arms, to the breast, to the abdomen, to the thighs. And so I think we've mentioned this in the past, that it's a massive weight loss patient, and you really have to stage the procedures because it's a lot of surgery. Like the woman we did last week, we did something with her arms and her breasts, kind of a nice combination, like an upper body lift. And then later on, we'll probably do her abdomen and her thighs. So it's really not something you can do all at once, just much too much
Yeah.
surgery time, too much risk, and very exhausting for the patient as well. So for men, I mean, a lot of men that have lost weight. Women get a usually problem even if they lost weight from pregnancy. It's so-called tummy tuck. So with a man, it's
Hmm.
almost like a tummy tuck. Sometimes you have to go a little farther back because there's loose skin in the back as well. And then the muscles are dependent on how the weight distribution was, whether they need to have the muscles tightened as well as the skin. It's mostly skin, but we'll do something for the muscles if necessary to help bring the waist in. And then with the pubic area, everything's kind of hanging, whether it's male or female. So these procedures help to pull everything up, which is a nice surprise as part of the procedure.
What do you do with the muscle? Is it similar to the in the female after she's had a baby, the diastasin,
Yes,
where you have to
exactly.
tighten
Yes,
it up?
exactly. The separation of the rectus muscle, and then we actually bring the muscle together to narrow that gap so that it brings the waist in. Same kind of thing as for a woman, exactly.
Yeah. And how big are those surgical scars?
Well, they're long. I like to say that people that have massive weight loss either on their own, they don't have surgery, but some people go through what's called bariatric surgery, where they have a stomach exclusion procedure so that they can't eat as much and they lose the weight. So that's a bariatric procedure. I don't do those. Once they've done that, it's been a year, their weight is stable, then they come see a plastic surgeon to take care of all the loose skin. And I always joke that they can do those stomach exclusion procedures through laparoscopic. So, small, little, tiny incisions that add up to that much length. But when we have to do an abdomen or a torsoplasty, that's a very long incision all the way across, sometimes around to the
Yeah.
back. It's very low. We try to keep it inside the underwear or the bathing suit line, so it's relatively well concealed, but it's a long scar. So I can't do that with tiny little scars because you have to remove the skin.
Right. It's huge. And
Yeah.
is 5 hours typically as long as you like to have someone under anesthesia? Is that how you base it?
That's about it. 5 to 6 hours is pretty much the maximum that you really want to do. I mean, you hear about people having their hand amputated and they have to put it back on, or face transplants and things like that. Or those can
Mhm.
take 12 hours or 24 hours. I don't do that kind of surgery. So and this is cosmetic. These are
Yeah.
patients that it's purely elective. They didn't lose their hand. They don't have to have this surgery. So you have to keep the risk down. And so 5 or 6 hours is about the maximum that you'd like to do. It's long enough.
Yeah, it's a long procedure. I'm sure for
Nurses,
you as well, you're probably tired
I,
after
I
five
was
or
going to
6 hours.
say, I was going to say the nurses and the OR techs and the anesthesia provider always they get a break. Someone comes in and spells them. They go to the bathroom. But the surgeon has to stay there the whole time. So I usually say like, when do I get my break? But I don't get my break. So that's the price I have to pay.
Well, we're going to take a commercial break, but when we come back, I'd like to talk about laser options for skin tightening for people who have less
Sure.
severe need for tightening. And why don't you give
Perfect.
folks your phone number and where to find you?
Great. So my phone number is 954-752-1020. We're located in Coral Springs, Florida, South Florida.
And yes. I think I said Southern California earlier. My son
That's
had to
okay.
do
That's
an
fine.
essay on USC today, so I have Southern California on the brain. But
Good
we're
for
going to
you.
come back after this short commercial break. We'll continue with Ask the Experts and Dr. David Levins.
Thank you.
Dr. David Levin, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levins can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levins has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levin's office today for a free consultation at 954-752-1020. That's 954-752-1020.
And we are back with Ask the Experts and Dr. David Levins, the best plastic surgeon in Southern Florida, not Southern California. I want to talk a little bit where we left off about what are some options that don't leave big scars but tighten the body, particularly, as we age in our late 40s and 50s and the skin's sagging and people don't want to do an aggressive procedure like, a surgery where they're getting cut and having huge scars. What are the options?
Okay, well, let's start with the laser options, and then we'll talk about other options. So laser is really a skin smoothing procedure. I'm talking specifically about ablative lasers. So that's like a carbon dioxide or an erbium. These are lasers that actually wound the skin very carefully and in a controlled fashion. It's like a burn, essentially. So, when you get a burn, 7 days, you get a nice pink layer of skin. So same kind of thing, a controlled removal of the top epidermis and a little bit of the dermis. And you can smooth the skin, you can tighten the skin, and you can make things look much better. So we usually do that for the face, the neck, not usually for the body, because the face heals really well, has great blood supply. If you do something like that on the body, you could run into some problems with delayed healing and scarring. So you have to make sure that the healing is within, say, like 7 to 10 days. Otherwise, if it takes much longer, you could end up with a real burn and a bad situation. So that's what I use generally for the face, around the mouth, around the face. Now, you mentioned when it's non-surgical. I do it often when I'm doing a facelift for someone that has a lot of lines around the mouth. I'll do the facelift and then I'll do the peel. But for someone, for example, with bad acne scarring, younger, that's also a nice treatment to do for the face. And so it doesn't necessarily tighten the skin that much, but it smooths the skin. It smooths the irregularities. It doesn't do the same pulling as a lift. And then when you talk about the body, well, then other lasers are lasers that penetrate the skin, so-called intense pulse light treatment. And so they'll go after a brown spot or a red spot. So they'll make those fade, kind of like a laser that's used for a tattoo. So it attacks pigment. It doesn't do anything to the surface. It gets beneath the surface. So that's to get to pigment or red spots or tattoos. That's a different type of laser. And then as far as the body is concerned, actually, radio frequency tightening is something that I'm really strongly looking into right now. There are radio frequency devices that you just apply totally externally, but there's a radio frequency device it's by a company called InMode, InMode, and they have a device called Body Tight and a device called Face Tight. So what it involves, it's bipolar radio frequency, and you do have to go inside the skin with one end, and one end is outside the skin, and it heats up the skin as you go back and forth, and you can combine that with liposuction. So for example, someone has an arm that's really not hanging as much as that woman that had to be cut away. A little bit of looseness, a woman that's 30, 40, 50, 60, a little bit of looseness, but not enough to justify a surgery. You can tighten up that skin by applying the radio frequency energy. And similarly for the abdomen, some people just need a tummy tuck. But if they have something in between, then you can treat them
Yeah.
with this, which is much less invasive, much less downtime, less costly, less recovery. Yeah, less recovery. And it's not a miracle. You have to carefully select people that have realistic expectations. If they think they're going to get a tummy tuck out of it, they're not. But if they think they're going to get some modest improvement of a little bit of loose skin from pregnancy or whatever, that's not a lot, then they will get that. So that's what it is. It's called radio frequency assisted liposuction, RFAL.
What percentage improvement can clients expect or patients expect to get from radiofrequency treatment?
You can get
Is
about
it
50% tightening of the skin, 50% tightening of the skin, which is really not too bad. And you could always do a secondary
not?
treatment. And then there are treatments that we have that can be applied on the top of the skin. So you can kind of attack it from under the skin and on the top. And what we use for that is also a similar radio frequency device that has microneedling built in. So microneedling, you might have heard about that. It's little needles that go through the skin, little punctate bleeding, and cause collagen synthesis. And it takes a couple of months to see an improvement. And you do a series of that. Very simple, minor, little topical anesthesia, quick procedure in the office. If you do the under treatment and then do the over treatment also, then it's a nice combination to really enhance that 50% even more.
So with that 50% and then doing, let's say, a couple additional treatments, can they expect to get 70 to 75%? I'm sure it varies
Definitely
on
not
the patient.
100%, but maybe like 70%. Yeah. Yeah.
That's good odds. That's great statistics. And
Yeah.
so
Yeah.
when you treat the top level of skin, you're essentially wounding the skin and then letting the body's natural repair process build the collagen.
Exactly. And it's the same thing as underneath. So you're developing more collagen underneath and where the fat is, some of the fat comes out, and you're developing more collagen on the top. So altogether, you're achieving that tightening.
Do you amplify the results by then using Retina A while it's healing? Does that help give you an extra?
Absolutely. Retin A is a great product for patients to be on. As long as they're not too sensitive to it, they have to be careful about sun exposure. But many of my patients stay on Retin A as a maintenance and put it on at night. Make sure to wear a sunblock, and that absolutely helps. Exactly. You seem to know something.
Love it. I love that product. You know what? I discovered it as a teen, and I realized it works better when you're older.
Yeah, you look really good. You look really good you look really good for 80.
Thanks, I appreciate that.
Amazing.
Hey, I have a question for you. Have you ever heard of a product called Morpheus, which I think operates with radio?
Morpheus 8 is the product we're talking about. It's made by the company InMode. We're looking to acquire that technology, and it's radio frequency combined with. What's that?
Sorry, I didn't. That's the same thing as Body Tight?
Well, the company is called InMode, and they produce a platform that has the Body Tight, the Face Tight, Morpheus. They have a couple other things too. Very innovative company, and we're looking. It's expensive technology, but we're looking to make it available.
I'm sure that's something that you're always having to do with your practice is continually stay up to date on the new lasers and buy new equipment. Probably quite a bit, right? There's always something coming out.
Yeah, it's interesting. Some doctors just seem to just jump on technology, but I like to sort of wait a little bit and make sure there's some validity to it. I'm not what you call an early adopter, but I want to make sure that there's definitely some validity, and there are a lot of articles. I've spoken to a lot of people, and I think it's a nice little niche because, for example, dermatologists do injections, they do laser, but they don't do surgery. We do surgery, but I also do injections and everything. So I have to have something for the middle ground for a patient that doesn't need or want the surgery and needs a little bit more than just a few injections. So it's a nice way to fill the gap and attract more patients to the office.
Yeah, it sounds like a great alternative. People who don't want to have, actual, cutting of their skin, it gives them a great option.
Exactly.
What's the oldest patient you've ever operated on? Have you done someone in their 80s for surgery?
I've definitely done a tummy tuck on someone in their mid 70s, and I've done a facelift on someone around 80. Yes.
Wow. So I'm sure they were a healthy year-old.
Well, that's exactly right. So I'm sure you know this, Rhonda, that there are some 80-year-olds that are healthier than some 50-year-olds. So it's all physiology and genes. And, you have a healthy, vigorous 80-year-old, and why not? Yeah.
Yeah, that's a true statement. I used to be a personal trainer and I had the most deconditioned 50-year-olds, but some people in their late 70s, could still do jump training. It is
Exactly.
truly dependent on the individual on a case-by-case basis.
Absolutely. Absolutely.
So I've got a question for you. Have you ever had a client come in and tell you they want to look like a certain star? Or I'm sure you got this when the Kardashian show was hot. Everybody wanted that butt, right? Came in, wanted
Yes.
a butt lift, the butt lift, wanted to look
Yes.
like a celebrity. You ever had a bizarre story? Go ahead.
Well, I mean, I try to avoid operating on people like that in general. I think it's an expectation game. And, not only do I not like to overdo things, but I like to have people look like a natural version of themselves. So, I mean, you definitely hear those stories and see those stories all the time on a show like Botch, for example. You see someone that's had 3 or 4 or 5 surgeries, and I'm so happy when the doctors at some point say, you know what, I'm sorry, I can't really help you. So that happens in my office sometimes, not necessarily that they want to look like someone, but I just really don't think I can meet their expectation. And you know what? It's not worth it. So I say, I'm sorry. And some people become very, upset. They're like, what do you mean? I'm going to give you money. You're not going to operate. I'm sorry. I'm not going to operate on you because I really don't want the aggravation. I don't think you're going to get what you want. And that's it. So I tend to turn people like that away. It's a personal approach philosophy. Yeah.
Yeah, and I think it's wise because it sounds like some of those individuals need more counseling than plastic surgery, right? There's something else going on.
There's a psych office right next to my office, so I can just say, "Hey, go and talk to someone first, and then get checked out, and then we'll proceed."
And then we'll have a talk, right?
Exactly.
So
exactly.
Would you say the most of your practice is geared toward breast implants and butt lifts, or what would you do the most of?
I would say breast is probably number one. Then like lipo, tummy tucks, then faces, a lot of injections. So patients that are too young for needing a facelift. But I've been in practice for 30 years, so I have patients that have kind of matured through the practice. In fact, today it was great. I had a patient. Literally, I took a little growth off her when she was 3, and now she's 23, and we did her surgery. So it's perfect. Yeah, it's really rewarding to see people come back. But you kind of have your own clientele, and then you try to attract new patients. But it's nice to see that people come back.
And if you're doing your job 20 years later, they still look the same age.
Exactly.
Well, give folks your phone number again and how to find you.
Okay. We are in Coral Springs. My phone number is 954-752-1020. The website is www.drlevens.com. We are doing virtual consults. We were doing them a lot through COVID, and we're still doing them now because I think it's a good way to get to meet someone like this. And once we seem to hit it off and it seems like it makes sense, they come to the office, less exposure that way. And so we are definitely offering virtual consults, which are free. And we also have free consults in the office, but we're just trying to keep the traffic down. So the virtuals will work well.
Thank you, Dr. Levens, for your time, and we look forward to talking to you in a month. And that's it for tonight. We hope you can get more of the show. We'll see you again soon.
Thank you very much.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers